name is Rory McCorkle, and I'm in English 111 D6J. My paper was about a CNA pay debate. Should they stay the same? Should they get paid more, or should they get paid less? Certified nursing assistants are a nurse's right hand, if you will. They need a certificate. They don't need a license. The course takes about a couple weeks to a couple months. Mine personally took 3 months, and I tested within 2 days. So certified nursing assistants can work anywhere from a hospital to a nursing home to rehab. It really depends on what you're looking for and how severe you're wanting to take after and look after. The average pay is $12.76 for North Carolina. For my opinion, I feel like that is a little low, considering the activities of daily living. That's what they take care of. They help residents get to activities of daily living. They do feeding. They change residents or patients. They feed. They groom. They just help the person. You don't want to enable the person as a CNA because they will eventually decrease function. A lot of healthcare rely on CNAs because they spend more time than a nurse with a patient because, they are helping that patient. They are changing, they're grooming, they're feeding. So they notice major changes as in, appetite, skin changes, like if the skin becomes wounded for being like a pressure wound, being on the side too long. Cognitive status, appetite, skin condition, I already said that, but mental health, stuff like that. They are 9 times out of 10 the first person to notice a code blue or the start of a code blue. They are most likely the ones to ring the alarm and let everybody know. The average shift for a full-time is 12 hours, kind of like a nurse. It's 12-hour shifts, and it's really daunting. You use a lot of your muscles. You pull, you lift. You help people get in and out of bed. You might need to use mechanical lifts, stuff like that. They come into contact with the most blood and bodily fluids because, they are changing, they're showering, they're doing stuff like that. It's entry level, so people argue that they should not get paid more, and they should relatively get paid the same than the state average because it is entry level, meaning you don't need experience, you don't need a high school diploma. Really, a high school diploma is only required within a year of employment or a GED. So typically it's really not, like a nurse needs a high school and college experience. A lot of hospitals influence CNAs to get higher education. They don't want people to stay at the same rate that they're going. They want them to grow and get more. So people argue that maybe that if they're paying to continue their education to, let's say, a CNA wants to be a nurse, then they should get paid the same because they're getting reimbursed by student loan, like they don't have to pay their student loans. Burnout is a big thing among CNAs. Their role as a caregiver. They help the people with everything that they should need. Throughout the day, they help nurses, doctors, they help everybody. Typically in a hospital, they float. So you can see them in many different floors of the hospital. So burnout is a really big thing. You have to pace yourself. And if you do too many shifts in 1 week, that can cause severe burnout. And a lot of CNAs weigh out I get time off than, my pay. While as doctors are like, well, I'm getting paid a lot more, so then I'm going to work more. And the burnout it's not as prevalent in doctors because they see the pay that they're getting there and it motivates them. So the debate is, should CNAs get paid more or should they stay the same or stay less? I say CNAs get paid more because personally as a CNA, I don't think people understand how daunting the task is. Yes, you have to have a heart of gold for it, but at the same time, like, you need people as CNAs. People that are CNAs should get paid more because they notice everything. They spend more time with the patient. I'm not saying a huge increase. I'm just saying most CNAs rely on government assistance because they don't get paid enough. And a lot of CNAs that I know work multiple jobs because they can't afford to live because they're not getting paid enough. So as a full-time, it's 3 12-hour shifts. It's already 36 hours. Most of them either work part-time on top of that, which is 2 shifts and 24 hours, or they work another full-time, and that's another 3 shifts and 36 hours. So they could work upwards of 70 plus hours a week. So I think CNA should get paid more, and that was my presentation.